How did the Doctorpreneur Academy help you?
It's as I told, it's the motivation of the both of you and even the members who are there already having the hospitals. This helped me a lot, sir. Definitely, I can say the courage to start a new setup and then to have another setup. So all this is because of Dr. Prneer Academy. I can say I had that in mind, sir, since a long time, but I could not implement it. So the implementing of the plans, definitely, it is because of Dr. Prneer Academy.
Hello friends, welcome once again to another episode of Hall of Fame interviews. And today we have with us Dr. Zamir Ullah. He is a very senior surgeon in Davangere and he is doing laparoscopic job also. And he has been joined with the Doctorpreneur Academy for the last 2 years and he is able to establish 2 major hospitals in Davangere. So, Dr. Zamir, congratulations and welcome.
Thank you, sir. Thanks.
So, tell us something about your childhood and other history, like how you always wanted to become a doctor or a surgeon, and how did it go?
My parents are from a village, sir, in Karnataka, and they shifted to Taluka headquarters, Davangere, which was Taluka at that time. Now it's a district headquarters.
Okay.
So I did my all education in Davangere itself, in the same city.
Right.
So yeah, I even did the MBBS and MS general surgery in the same medical college, in the same city.
Okay.
Yeah, and proudly I can say like I'm the first doctor in the family, whole maternal and paternal family. I'm the first doctor.
Great.
So it's all by the grace of God and the work of our parents. So now, since 18 years, I have been a professor in the medical college in the same city, the new medical college, which had come out. So like I wanted to do private practice. So I started my private practice along with college teaching job. But I didn't have that somehow I can say the courage to start a whole new setup, including the inpatients, operation theater, everything. So I had that desire, but somehow it was already maybe I can say it was framing. So when I joined Dr. Prneer Academy, like with your support, with Dr. Amit's support, motivation, and having a community of entrepreneurs, Doctorpreneurs, I can say. So that gave a lot of courage to me to start a setup. So ultimately, I did that finally in 2023 May. I joined Dr. Prneer Academy in March, I think, 2023.
Okay.
Yeah, 2022. So within 1 year, I started my setup.
Great.
Yes, sir.
So what was going through your mind when you were actually contemplating or thinking about starting a setup? So what all fears or the dilemmas are there?
Mainly, I was thinking about the finances and the mandatory licenses and all.
Yeah.
Yes, sir. That's sir. So all those licenses, I was thinking like it's a big thing and maybe it's not possible from us. But when I came to know everything in detail about all the statutory requirements and it's not that difficult, I thought like later. So we started one step at a time and then finally we got it.
Okay. So first hospital that you started,
Yes, sir.
how much investment or how much money you put in, or what was it, like a rented setup or your own setup?
Yeah, it is a rented setup, sir. Actually, there was a hospital in this building before. Actually, like they stopped. They had some legal issues with the owners, and then it stopped for 3 years. There was nothing in this building.
Okay.
Then I approached them, and it was okay. And then with lot of negotiations, we finally decided to start this building itself. It's a rented one, and the investments actually, like I can say, like it's I did a lot of jugaad and I didn't compromise on the patient safety. But apart from that, all these furnitures and all those things, like somehow like I made it to within 60 lakhs, including the statutory requirements, everything, even the fireworks, the fire safety work. So 60 lakhs was my total investment.
When you started, then what was the first few days like? Patient flow and everything.
Yes, sir. I was very apprehensive, like whether the patients will accept or whether, because till then I was seeing my patients in my clinic and I was admitting in other hospitals.
Right.
So I was thinking like whether the patient will agree if it is a new hospital and all those things were there. But the very first day I admitted one patient and operated the next day.
Hmm.
So that gave me a confidence, and that was a kickstart. And already we have finished, I mean, we have done 700 surgeries
Wow.
in 2 years.
Wow. That is a big
Yes.
number. So first few days are testing times, right?
Yes, sir. Definitely. It was a testing time, right?
How did you manage the HR? How did you hire the people in your hospital?
Yes, sir. Till now, I am. My son even tells me like I'm a self-employed guy. So it is not into automation right now.
Hmm.
And the HR, even everything I only did, sir, actually, like one man show of a sort. So that's what I want to stop, and maybe like in the future I want it to be automated, and that help I need from you.
We'll definitely help you.
Yes, sir. Yes, sir.
No, I was asking about the procurement of the devices and instruments and starting first few staff that you got. So how did you
Okay.
take interview or you search in from the
Yeah.
hospitals or some online sites?
Okay. The vendors, I knew some of the vendors because I was working in the nursing home. Like I used to operate in the nursing homes. I got the contacts from them.
Hmm.
So and even the local vendors also I approached, and even in India Mart, and I did a lot of research into that.
Right.
So ultimately, I found some good guys who were able to give me at a very fair price.
Okay.
Because as you keep telling in the sessions also, sir, so a
Right.
lot of research has to be done into these things. And for one example, I can tell, sir, the laparoscopic instruments, hand instruments,
Hmm.
the people who are quoting it is 2,30,000 for a
Hmm.
set of normal instruments. Just as an example, I'm quoting it. I got it ultimately for 30,000
Right. Great.
with a lot of research, and I shortlisted so many vendors, and then I went into their online status, everything I saw, reviews, everything, and then I tested the instrument also. It was quite good, and
Okay.
since 2 years I have been using the same instruments with no problem at all.
Right.
So likewise, I did for every other thing also.
So to hustle out some of the energy before you get a fair deal.
Yes. That has to be done according to me. Otherwise, like we'll be spending this 60 lakhs would have been 2 crores for me.
Right.
Yes.
Great. So if I someone asks you that step by step you tell how did you start your hospital first one and then I got confidence on the second one. So what are the major steps involved? Like when did you actually plan? How much time it took for the setup to be built up, and then when did you do the inauguration?
Yes. Totally, I can say like before I started, before the first day of working for hospital, maybe some 9 months I had to do each and every work, sir.
Mm.
Like the negotiations with the owner of the building and all, it took a lot of time to me.
Okay.
Maybe 4 months or 5 months went into that only.
Right.
So and with your sessions and with the videos what you have in the this thing in the app,
Yeah.
so all those things helped me a lot in even the negotiation with the owner also.
Yeah.
So somehow like we decided, and then in the meantime only I started contacting the vendors, everyone.
Right.
So those negotiations were also going together.
Mm.
So that saved me a lot of time. Once this deal was done with the owner, we got the agreement, registered agreement, everything done. For 10 years, I got the registered terms.
Okay. Mm.
So rent agreement with the increments of every year, 5% like that. So once I finalized that, the vendors were ready to supply me everything. So in that way we went, and within a span of 5 months from that negotiation, we started the hospital.
20
Yes, sir.
bedded, right?
Yeah, 23 bed.
So how much area is there? Carpet or floor area?
So this one's actually in the main city near the medical college, near the district hospital. So it has a 40, the space is 40 into 70,
That's
ground and first floor. Yes.
around 2,800 square feet.
Yes,
Nearly
sir.
close.
2,800 into 2, so it becomes
22.
5,000. Yeah, 5,000 plus. Yes.
How is your patient response?
Yeah. Patient response is fine, sir. Like this is a old building. One or two patients they complain of the little infrastructure facilities, smaller things like the plumbing work is not proper. That all those things will be there. Just 1 to 2% of the patients they respond like that. Baki, they are all happy, sir, because the care we give and whole time I'll be there in the hospital. So they'll approach me anytime. So that kind of thing is there. So 98% of the patient doesn't have any problem with the old setup or old building infrastructure.
They're concerned about their health. That is more important.
Yes, sir. Yes, sir. Yes, sir. That's the main thing. They come for the hospital. Some yeah, they can go to the other good hospitals. I mean, in terms of infrastructure, but somehow like they come to me because they are bothered more about the care because they'll be having all the facilities at home. In the hospital, they'll be staying 1 or 2 days. They don't mind it usually, but 1 or 2% of the patient they'll feel like that.
You are
So
taking proper feedback.
yeah. As you told in the other sessions, Google My Business, I started in 23 only, and right from the first day, we used to take the feedbacks from the patients, every patient. But the thing was, like for 1 year, 1.5 years, actually the receptionist was doing that, and it was not that proper. I mean, all the works she'll have to see, and then somehow it was when in a session when you told like one dedicated person should be there for GBM.
Yeah.
So I immediately appointed one person, sir. Since then, since a span of 4 months, I got some 400 reviews.
Wow. So that works. If you
Yeah,
put
on a
in people
positive
and
reviews.
for proper work, if you dedicate them for particular work,
Yes,
then it works.
yes, sir. That helps a lot, sir. That helps a lot.
Has it converted into your GMB helped you patient inflow also?
Yes. Definitely, it has helped, sir. Definitely, it has helped because they'll see many of the patients. Like maybe I can say like 50% of the patients at least they see the reviews. They search in the Google.
Yeah.
Google Maps or even in the other platforms like this Just Dial and all,
Yeah.
then only they'll come. So they keep calling me. What I have done is I have given my number in the Google, sir. So they'll definitely directly call me. So I know
Oh,
the response. Yeah,
okay. That is good.
that has helped a lot.
So what all you have done for the brand building or this
Yes, sir.
marketing?
So that I have not done much, sir. Apart from this social media branding, I've not done much. Physically, I mean, what I can say offline.
Okay.
So online, actually, like I have got accounts in Instagram, Facebook, LinkedIn, and GPM, as I said. And I have created some WhatsApp groups of my old patients, which were
Okay.
there in the clinic. The database was there. So that also has helped a lot because one-to-one touch of care will be there. Like whatever new things or whatever we are doing, that I advertise I mean, send the messages to those patients in
Yeah.
the groups. That has also helped a lot.
So you have made some YouTube videos also?
Yeah. With your YouTube channel also I made and some 30 videos I could manage to
Okay.
record, sir, which
Okay.
is very less according to me. So I would have done some hundreds also
Yeah.
every day because I was very much into editing things. Like I wanted the videos to be perfect and a lot
Yeah.
of editing I used to do myself. That used to consume a lot of time.
Uh,
So since very recently, I have started in this setup only, like where I'm sitting in the
mm,
clinic in my chamber.
mm,
So now I've started doing short videos on some procedures,
right.
like for example, the stapler circumcision, which I started.
Mm.
So the response is better than those edited videos.
Naturally, if you work, then it flows in a much different manner, and people relate to it, and people actually don't mind your vulnerability. They want to
Yeah,
see as
exactly,
you are,
exactly.
because that too much edited thing is like a processed food.
Yes.
Mm.
This
So tell
looks
me
like
about your
organic program. Yes.
yeah. Tell me about your family. Who all are there?
Yes, sir. We are three brothers.
Okay.
Family. Our parents have three children, and all three brothers, no sisters. I am the youngest,
Okay.
and in my nuclear family, my wife is a housewife, and
Oh,
I got three children, one son and two daughters.
okay.
So son is doing first year MBBS now. So this year,
Very good.
got the admission in medical college in Karnataka.
Okay.
So he's doing first year MBBS now. The
Okay.
other two kids, they are in the school still, high school and primary both. Yes.
Good. Good. Great. So how do you manage the family time and the work?
Yes, sir. Once I started this hospital, earlier before that, what used to happen, I used to work in a medical college from 9 to 5.
Right.
And 4 times we need to do the attendance, punching. biometrics. So 9, 1, 2, 5, we used to punch, and we used to be there all the time there. And then in the afternoon, 1 hour for lunchtime, I used to go to my clinic and then come back. So 9 to 5 is full busy.
Mm.
And for my clinic, I used to go in the evening from 6 to 9. So only 1 hour in the.
Right.
So for surgery cases, I used to operate in the early morning hours, 6 or 7 like that. So whole day used to go in the work only.
Okay.
So once I started this hospital, I stopped going to the medical college. So from 10 to 5 and evening 7 to 9, I used to work till
Okay.
recently, sir, till maybe 6 months. From 6 months, I have changed my time. So a lot of family time now because I start my work at 11 o'clock in the morning. I come directly to the hospital
Okay.
till 5, 4 o'clock. I finish all the work. So 11 to 4 is my working time, all inclusive, doing the rounds, doing seeing the OPD patients, having the meetings with the manager and the staff, and operating also in the same time. So 11 to 4, 4 o'clock I'll be free.
This
So
independence you get only when you are an entrepreneur or your
yes.
own setup.
Otherwise, it's not possible.
If
Otherwise, it's
somebody
not
else
possible.
is deciding your time, then you are going to work like a dog.
Yes.
Ah.
Till 11 o'clock in the morning, I'll be with the family. I'll drop children to the school sometimes. Otherwise, they'll go in the taxi. I mean, in the school bus.
Mm.
So some when the kids come back, I'll be there at home for them.
Good.
So that's the biggest advantage I can say being an entrepreneur. And since I started this second branch, so I had to spend some time over there. So I go there at 7:30 and come back at 9:30 in the evening. So evening 7:30 to 9:30, I'll be there in that hospital. So after that, I'm free only again.
So when did you decide or think that now I need a second branch?
Yes, sir. So this city actually is divided into the older city and the new city like that. The older city has got a lot of population, sir. Like I mean, it's dense populated.
Right.
So this first branch of mine is in the newer city. So I always had that feeling like because those patients will go to the nearby quacks and the general practitioners, and they'll not come. They'll not come to this part of the city.
Mm.
So since beginning only, I had that in mind that I have to spend some time over there, a clinic or a branch or something like that. So almost at the end of 1 year of my first hospital, I started searching for a proper this thing building over there.
Mm.
So in 6 months, I could manage, and I started another branch. So this is running since 6 months now, sir.
So how do you manage your time in both the branches? Where do you go? How much hours?
Yeah. The second branch actually because it is a smaller one and it's still in a, and it has to start properly.
Mm.
So I have duty doctors over there 24 hours.
Okay.
So and even the consultants, some visiting consultants are there. They come, they'll see the patients. So I spend my time over there only 2 hours, so 7:30 to 9:30 in the evening.
Okay.
So all my patients, those who want to show to me only, like they'll be gathered over there at that time. So I'll see all the patients. OT recently started, sir. There, I did my ritual circumcision camp over there.
Okay.
So with that, the OT also started. So maybe in the future, like I'll have to spend a little more time over there. So let me see, sir, how it goes.
You are coming to Goa.
Yes, sir. Yes, sir. Definitely, I'm coming. Last time I missed, somehow I could not attend that. So since then, I had that in mind that next I'll have to attend. So this time
Great.
I'm going.
Great. You will get a lot of inputs for the video making and celebrity.
Yes.
Okay.
Yes. Sure, sir. I'm eagerly waiting for that, sir.
How did the Doctorpreneur Academy help you?
Yes, sir. It's as I told, it's the motivation of the both of you and even the members who are there already having the hospitals. This helped me a lot, sir. Definitely, I can say the courage to start a new setup and then to have another setup. So all this is because of Dr. Prneer Academy. I can say I had that in mind, sir, since a long time, but I could not implement it. So the implementing of the plans, definitely it is because of Dr. Prneer Academy.
What is your message for new budding doctors who are planning their career?
Yes, sir. Well, I keep telling even my students and even my juniors also, the duty doctors also, the juniors. So I tell them like to start off as soon as possible.
Right.
You should not wait for a long time, just like I did. So better to start as soon as possible your own setup. You should not be subordinate to any. I mean, you should not have a boss. That's what I feel, sir. Because those 18 years, I have lost a lot of what I can say, the family time, the quality time with the family. Although I used to arrange somehow for a short breaks once in 2 months or 3 months like that, but that needs more than that, sir. The family needs more than what I used to give.
Exactly.
And so for the juniors, I can say like it's better to start off as early as possible, not immediately after your graduation or post graduation, but you finish off your education first, whatever you want to achieve, the ultimate MCH or DM, or after that also some fellowship, whatever. But soon after that, maybe within 1 year of your experience in some other hospital, you start your own. That's what I can tell them, sir.
Great, Zamir. It was great talking to you, and you got a lot of inputs also.
Thank
And
you, sir.
the audience must have inspired by your journey.
Sure.
See you in Goa, and
Right, sir.
we'll have some nice time there.
Sure, sir. Sure, sir. Thank you.
And congratulations and best of luck once again.
Thank you, sir. Thanks a lot, sir.
So if you want to understand and hear how we have helped Zamir and many other doctors like him, there's a link which is given below for the webinar. You can attend the webinar and see how we work. And once again, we will be putting the details of Dr. Zamir also. You can contact him. He will be more than ready to help.
Sure, sir. Definitely.
Thank you. Thank you so much.
Thank you, sir. Thanks a lot.